For many years I've had a problem with my bunion, and I was in a professional environment, so it limited me from feeling like I could take the time off necessary without having high heels and a business suit on. And I retired a year ago, so it was basically, you know, on my to-do list. It was my bucket list of something I had to get done. And I'd actually seen Dr. Nagler about 2 years ago for something totally unrelated, and I really liked him. I just, you know, I actually found him online originally, but I had met him at that time, and he gave me a cortisone shot. It was, and he just has really, honestly, one of the best personal human touches, you know, of physicians. I've been around a lot of them because my parents are elderly, and he's just really great with people. I had a bunionectomy, so he went in and you know, it was a fairly severe, I think I had about an 18% deviation with my toe, and there was lots of pain. I mean, it was come and go, but a lot of pain, and it was at a point, I also am a nature photographer. That's one of the reasons I retired from my professional career. And so I need to hike, and I lead tours all over the world, and my foot has to be in a place where I can put my hiking boots on and do whatever I need to do. So so I sought out his professional care to do the surgery, and he did the bunionectomy, and he did a great job. The toughest part is the rehab. I mean, it's the aftermath. It's not really the surgery. It's just that you have to be committed, you know, to get your foot back in shape. But as he said, it's perfect. That we did talk about the fact that, you know, I didn't want to have a lot of scarring on my foot or top of my foot because I wear a lot of sandals and, you know, so on. So he did, you know, he said he'd pay, you know, very good attention to that for me, because that was, you know, a procedure that he, you know, wanted to make sure he did. That, you know, that's how he approached it. So yes, he did the incision on the side of my foot, you know, at this point there's a very faint scar. About a month ago he prescribed a compound ointment to put on to help to also, you know, mitigate the scar. And, you know, at this point it's very, very minor, and, you know, most people can't even see it. I know it's there, and I feel it because there's just still that part of recovering, you know, with a little bit of scar tissue. But other than that, I think it's going to ultimately be great. I've already, you know, I've talked to several people. My trainer I work out with, she's got a problem, and I looked at her foot actually yesterday, and I was appalled. I was like, oh my gosh, girl, you have got to go and get this taken care of, because you're going to be crippled at some point. So there is no doubt. I've told, I think, 3 or 4 people already, because it's amazing how many women have issues with their feet, but they really never talk about it until the subject gets broached. And so with that said, I mean, I would recommend him, you know, to anyone that, you know, that approached me and or that I had a conversation with. There's 2 reasons. First, I think he did an excellent job. He made me extremely comfortable. I mean, after, you know, this is a funny question. I asked him even before, can I have a pedicure a couple of days before, because I don't want my feet and my toes to look bad? And he was like, yeah, sure. And I said, can I have nail polish on? He's like, yeah. So he came out of the surgery, and one of the main things I remember when I came out of surgery, he says, I didn't mess up your toenail polish. So at the end of the day, he's a great personal individual. He's obviously a professional at what he does, and I think he's, you know, a superior doctor in his field.